Le Nissan Kick-Play 2025 a beaucoup de plus. Apple CarPlay intégré pour jouer vos tunes préférées, des fonctions avancées de sécurité, un rendement énergétique remarquable, puis même la petite odeur de char neuf qu'on aime tant. Tout ça en plus pour moins. Le Nissan Kick Play 2025 est le véhicule neuf le plus abordable au Québec. Achetez-le à partir de seulement 22 774 $, incluant un rabais à l'achat comptant de 2 600 $. Profitez de cette offre avantageuse chez votre concessionnaire dès maintenant. Jusqu'au 2 mars, des conditions s'appliquent. Détails chez Nissan.
Add Quebec's College of Physicians to the brigade recommending masks in public as child respiratory infections surge. And a recent survey shows a majority of Canadians would support indoor mask mandates. But here's the thing. It is not September 2020. It is not February 2021. It's November 2022. And for this day, for today, the question I have for you is, who should be deciding if we wear masks? You for yourself or governments for everybody? That's the question I have, but I want to bring Dr. Christopher Labos into the conversation here, who joins us on the line. Dr. Labos, thanks for coming on this morning.
Oh, my pleasure as always.
There are a couple of questions that I want to ask you because I just don't feel like doing a phone-in segment without talking to a doctor, especially, for something like this is something I want to do. I want to make sure we get some facts out of the way, okay? So here's a question that I have. Especially what we're seeing now in our hospitals, right? And the child respiratory infections, the respiratory viruses. I've heard that the reason we're getting hit so hard from these viruses, these respiratory infections, is because for a couple of years, kids avoided that, right? And for a couple of years, we didn't have the flu spreading. So now the flu is back in a bigger way. So one of the things that goes in my brain is if we bring back the masks, let's say for the next year, masks again in public, in schools, we bring back these mask mandates. Don't we just delay what we're seeing right now? So shouldn't we just get it over with? Dr. Labos, that's my question.
Right. So here's the problem. That's actually not true. What you're talking about is this concept that's been floating around the internet called immunity debt. And it's not true because it's not actually a medical term. It was a term that was coined a year ago in this sort of editorial paper where people were arguing that maybe lockdowns could be dangerous, et cetera, and then it sort of got picked up and has been spread around social media. But it's not a medical term in the same way that andropause is not an actual medical term. So it's a thing that people say, but it's not actually real in the way people mean it. Because the problem is this. It's a different flu virus every year, right? It's a different reassortment of the flu virus every year, so it's different, which is why you need a different flu vaccine every year. So getting the flu one year is not going to affect how you get flu the next year. And the problem with RSV is that people are claiming, like, oh, there was no RSV. Well, yeah, there was a lot less, but there was a big spike of RSV cases in the summer of 2021, again, when the public health measures were lifted. So it's not as if children have been unexposed to RSV. They have been exposed to RSV. It's just that you can get RSV multiple times. So not getting RSV now isn't really going to affect how you get RSV in the future. I mean, really.
So, Dr. Labos, why is it happening now? Why are we seeing this surge right now?
So a couple of reasons. One, this is when respiratory viruses tend to surge. Number two, we don't have the public health measures in place to blunt it. 3, influenza is probably surging because it is a more virulent strain. But 4, I think we're just talking about it more because we're seeing the impact. I mean, the surge of RSV that happened in the summer of 2021, yeah, we talked about it a bit, but it wasn't making headline news because it was an ignorable problem because the healthcare system just sort of absorbed it. Now the problem is the healthcare system can't absorb it because all the burnout, all the people who have left, and now you have multiple things happening simultaneously, and you're getting the cancellation of surgeries and everything happening simultaneously. So it is worse, but it's also we're talking about it more, and it's the perception of the problem that I think is really shocking people more than it was in the past.
Dr. Labos, well, we also have the subject of human behavior, right? Just how humans will behave. We've been through a couple of years because of the COVID-19 pandemic. A lot of people are fed up. I went shopping downtown yesterday, St. Catherine Street, the Bay, everywhere. Hardly saw a mask. It wasn't like I didn't see them, but maybe, less than 1% of people were wearing a mask, right? So on that end, right, isn't like, and I think as doctors and medical professionals need to look at this as well. Sometimes human behavior is just going to win. Like it feels like people are just fed up and we have to deal with it. What do you say to that notion on human behavior and how maybe we do have to move on for the sake of, people's mental health?
So a couple of things. Here's the thing. If we had taken that approach to anti-smoking laws, we'd still have a lot of lung cancer. I mean, we basically have two choices to make. We can either accept things as they are, or we can try to make the world better. And previously, we actually tried to make the world better. We passed anti-smoking laws. We improved, food quality, air quality. Part of the reason why Health Canada and the FDA were established originally at the beginning of the 20th century was to improve the issue of food quality because food would used to spoil. So we've made many advancements in the field of public health because we constantly strive for this type of incremental change. The public is always going to oppose change to some degree because that's human nature. But eventually, things do change. I mean, I grew up in a world where you didn't wear a bicycle helmet when you rode your bicycle, really. I grew up in a world where, you didn't always wear your seatbelt in the back seat of a car. Where car seats weren't really that big of a deal. I mean, things change, and they often change for the better. So we've got to decide, do we like the world as it is? Are we okay with waiting 12, 18, 24 hours in the emergency room, or do we want to change things?